Hello everyone, this is Dr. Jaffrey again, and today I'd like to speak to you about COVID-19 infection and subsequent risk of having blood clots. First of all, when you have COVID-19, you're at very high risk of having blood clots if your oxygen is low. Subsequently, when you get over the infection, the risk declines with time. However, it's been shown that about 30% of patients who have COVID-19 do eventually have blood clots. Now, out of these, about 16% have the clots in their legs, that is something called a DVT, and about 14% have clots in their lungs, which is something called pulmonary embolism. Patients who get admitted to the ICU have an incidence or have the chance of getting blood clots more than 20%. Now, COVID-19 is a hypercoagulable state, which basically means that it causes clotting. And the way it does is basically the virus is in your body and that causes something called inflammation. And that results in more a state where they're high risk of having blood clots. Now, there's certain things that actually do predisposition you to having more blood clots. Number one, if your weight is more than usual, you're an obese person. If your age is more than 65, that increases more risk. And then, there are other causes as well, such as if you require more and more oxygen, you have higher risk of having blood clots. Now, what is the increased risk? It's about 7 to 8-fold, according to the recent study that just came out. You're 7 to 8-fold more likely to get a blood clot when you have a COVID infection. Now, how do you detect this? There's actually a very good test which you can do with the blood. It's something called D-dimers. And while you have a COVID infection and you're having worsening shortness of breath, ask your doctor, or your doctor should get a D-dimer test. And if that level is high, you should be on a blood thinner. Now, this again is not medical advice. You should consult a physician, but this is just the general interpretation for a regular person regarding the research study that's out there. Thank you. Please do subscribe to the channel if you found this information to be helpful.